Hello, my name is Simi Badero Nunez, and I will be speaking to you about infant safe sleep with a focus on how Baltimore City hospitals, clinics, and providers can support patients and their families in understanding the life-saving importance of safe sleep. Thank you for taking the time to listen today. I work at the Baltimore City Health Department and with Be More for Healthy Babies, our citywide initiative to reduce infant and maternal mortality. Be More for Healthy Babies involves partnerships with government agencies, community-based organizations, and other entities that are looking to have an impact on maternal and child health. This work includes community-based efforts, support groups for moms, events around the city, billboards, bus ads, and all sorts of different things aimed at protecting the health of moms, babies, and families throughout Baltimore City. We also offer a portal with more information for providers. That provider portal is available at our website, healthybabiesbaltimore.com. Be More for Healthy Babies has seen some pretty incredible results since we started in 2009. That includes a 44% reduction in infant mortality and a 49% reduction in the black-white gap in infant mortality. And in 2021, we saw the lowest infant mortality on record for Baltimore City. In today's training, I'll talk about Baltimore data and safe sleep, some resources that you can refer families to, and communicating with patients. We offer this training because we know that families value guidance from their providers, and we understand how important it is for everyone to emphasize the same messages so families clearly understand how to keep their baby safe. Thank you for taking this time to learn more. First, we'll look at data from Baltimore and talk more in detail about infant safe sleep. So, exactly what is a sleep-related infant death? We define sleep-related infant death as the death of a child before their first birthday that occurs during sleep and is not determined to have resulted from a medical condition or a prior injury. Under that umbrella of sleep-related infant deaths, we have three categories. Accidents are deaths that happen to infants due to unintentional suffocation, asphyxia, or overlay in a sleep environment. In these cases, we have very strong evidence of complete coverage of the baby's nose and mouth. Undetermined deaths are also known as sudden unexplained deaths in infancy. In these cases, there's evidence of unsafe sleep factors in the baby's environment. There isn't enough evidence to definitively call it an accidental death, but it is strongly thought of as likely being an accidental death. Lastly, we have natural deaths, also known as SIDS, or sudden infant death syndrome. These are deaths that are natural and often ill-defined, and these kinds of deaths are very rare. Most sleep-related infant deaths in the city are accidents or undetermined deaths. With these, we either know definitively that it was an accident, or there is a lot of evidence of unsafe sleep factors, and we suspect an accidental death. In 2009, Baltimore City had one of the worst rates of infant mortality in the country at 13.5 deaths per 1,000 live births, and Black babies were 5 times more likely to die than white babies. That number had been rising for a very long time, since 2000. So, in response to this, leaders from government, nonprofit organizations, academic organizations, and corporations came together to launch Be More for Healthy Babies. We decided to focus on getting the word out on sleep-related infant deaths and on safe sleep. And once we established the initiative, we saw those numbers start to go down. However, after 2020 and during the COVID-19 pandemic, we started to see those numbers go up again. This was likely due to halts in programming and not being able to see families in person, showing how important it is for us to really be able to drive home that safe sleep message. The most up-to-date data is available in the provider portal I mentioned earlier. To be clear, any infant in an unsafe sleep environment is vulnerable and can face a sleep-related infant death. If a baby goes home from the hospital healthy, the biggest risk to their survival until their first birthday is sleep-related infant death. Even a healthy infant with absolutely no risk factors can become wedged between a wall and a mattress or suffocated via overlay. However, it's important to note that the risk for sleep-related infant death is cumulative. The greater the number of risks present in the infant and in their environment, the greater the risk of death. We touched on this earlier, but this is more on how sleep-related infant deaths can occur. You can have an accidental suffocation by a soft surface or soft bedding, which you can see in the image in the bottom left. You can have an overlay, which is when another person rolls on top of or against the infant, blocking the airway, which you can see in that middle image. And in the bottom right image, you can see an example of wedging or entrapment, which is when the infant gets stuck between two objects. Over the next 4 slides, we'll look at some of the data on when and how these deaths occur in the Baltimore area. In Baltimore City, we have a program called the Child Fatality Review. It's a confidential process where we review all cases of unexpected or unexplained child death happening to Baltimore City residents. In this body, we review every single case of sleep-related infant death. This includes data from the investigation, the child's health records, the parent's health records, and any locally maintained records pertaining to this death and the history of the family. Every jurisdiction in Maryland has a similar program, and a lot of data and learning come out of this work. From this data, we know that between the years of 2016 and 2020, 72% of sleep-related infant deaths in the city and 82% in Baltimore County occurred before the child was 4 months old. Nationally, 90% of sleep-related infant deaths happen in the first 6 months, and this is also reflected here in the Baltimore area. You can find more up-to-date information on the provider portal, but the data shown here is reflective of consistent trends that we've seen for decades. When considering sleep environment risk factors, we saw that in these cases, the vast majority of the babies were sleeping outside of a crib. About 1/3 in the city and more than half in the county were not sleeping on their back. Most of them had soft bedding or other items present in the sleep environment. In the city and the county, more than half were surface sharing. And we saw a fair amount of tobacco exposure, which we know is also a big risk for sleep-related infant deaths. The data also looked at the person placing these infants to sleep. Most of the time, it was the mother. However, you can see that caregivers such as fathers, grandparents, and others, who might include cousins, siblings, and friends, also place infants to sleep. This really shows how important it is that not just the mother receive education and information on how to put a baby to sleep. Anyone who's coming in contact with a baby should be aware of this information. In the city and the county, the vast majority of families experiencing this devastating event are people who receive Medicaid. This really shows why providers are so important. You all are the ones who can connect families to resources through critical referrals. These include the PRA, which stands for the Prenatal Risk Assessment, and the PMER, which is the Postpartum Infant Maternal Referral. By submitting these referrals for your patients during prenatal care and after delivery, you can connect them automatically to care coordination and other resources that can help them with the challenges they may face when consistently putting their babies to sleep safely. The triple risk model shows many risks that can put a baby in a dangerous position. The more that these factors overlap, the higher the risk. First, you have this critical period where the baby is under 6 months. This is a time of a lot of change physiologically. As you know, there are many changes in homeostatic controls, and the baby is in this physical state of flux that can put them at risk for negative outcomes. Next, external stressors can up the risk. That includes smoke exposure, putting the baby on their side or stomach, soft surface or bedding, surface sharing, substance use, and overheating. That baseline risk that exists within the critical period increases with each one of these stressors. Lastly, other factors can make an infant particularly vulnerable to a negative outcome. That includes prematurity, low birth weight, smoking in pregnancy, substance use in pregnancy, respiratory illness, and genetic factors that we still don't fully understand. On the last point, we'll continue to look to the scientific community to pursue research that helps us better understand these factors. All of that is why I'm here to talk to you all about Baltimore's Sleep Safe campaign and the ABCDs of safe sleep. We know you are extremely busy and you all are tasked with providing a tremendous amount of education to families. However, you all are some of the most trusted individuals that families look to for health information. This training and our provider portal are here to support your practice and make some of this engagement just a little bit easier. We appreciate your willingness to share this vital information. The ABCDs of safe sleep are basically A for alone, B for back, C for crib, and D for don't smoke. A is for alone. Babies should sleep alone, and that means no adults or children in the sleep environment. You can share your room, but you just can't share your bed. That means no toys, no bumpers, no pillows, no blankets, no stuffed animals, no soft items in the baby sleep environment at all. B is for back. Babies should be sleeping on their back. It's the safest position for sleep because it allows infants to be able to arouse more easily, and they're less likely to have their airway blocked when they're sleeping in this position. Infants are less likely to choke on their back because of the position of the windpipe and the food pipe. You can see that when a baby sleeps on their stomach, any type of spit up or emesis that occurs can flow into the trachea and then the lungs, causing choking. However, when you put the baby on the back, gravity acts on that emesis or that spit up and it flows right back into the stomach, which is a lot safer. C is for crib. The baby's crib should be clean and clear with a firm mattress, a tight-fitting sheet, and nothing else. So, what counts as a safe crib? Here, you can see we have a traditional crib, but other options serve as safe cribs as well. A bassinet, a pack and play, and a side sleeper are all considered safe cribs. It's important to note that Baltimore City makes pack and plays available through Healthcare Access Maryland. A link to access that resource is on our provider portal. However, we know that in Baltimore City, our families face a number of challenges. They might be facing housing instability. The infant might be in a situation without their usual crib available. What should we tell families to do in situations like that? Here, you can see a number of acceptable alternatives for use in an emergency. The American Academy of Pediatrics says you can use a cardboard box, a basket, a laundry basket, or a dresser drawer as a safe alternative in an emergency. Every time, these should be used with a thin, firm padding. Again, no pillows, blankets, or soft objects. D is for don't smoke. Don't smoke while you're pregnant. Don't allow anyone to smoke near your baby or in your home. Ask family members who smoke to change their clothes before they hold the baby. Don't allow anyone to smoke in your car, even if the windows are down. And, if possible, choose babysitters who don't smoke. And when we say smoke, we don't just mean tobacco. This includes marijuana, vaping, and anything that would produce smoke. A marijuana brief that you can use is also linked in our provider portal. I've mentioned resources that Be More for Healthy Babies created for both providers and for providers to share with families, supporting the work of your practice. These materials linked in the portal are in alignment with best practices and AAP guidelines. They've been developed and pre-tested in partnership with the intended audiences. Be More for Healthy Babies offers many resources for teaching the ABCDs. We have videos in English and Spanish. We have free print materials, and our website has frequently asked questions that can be of use. I want to highlight a few other resources that are directly related to the ABCDs. These include our Be More for Healthy Babies website, healthybabiesbaltimore.com, the American Academy of Pediatrics' most updated recommendations, the National Safe to Sleep campaign, the Center for Infant and Child Loss at the University of Maryland that can be utilized whenever you have a patient who may have experienced a loss of an infant due to sleep-related causes, and the Cribs for Kids Safe Sleep Academy. For ease of access, all of these are provided as links on our provider portal. We know that when you're educating families on safe sleep, you have very limited time. However, during your encounters with patients, it's important to consider that this is a critical moment to deliver useful health information that could help protect their babies from a negative outcome. Families come to you through different programs and face different barriers. Having a newborn in the house is stressful. Parents may be experiencing work or relationship stress. They might have multiple young children in the home, cultural barriers, or mental health challenges. In short, we know that consistent safe sleep can be really tough. When we're talking about safe sleep, it becomes critical to use a non-judgmental approach. This comes across in non-judgmental language and communications, in how we respect the family's culture, in awareness of any assumptions and nonverbal communications, and in efforts to use interpreters when needed, when English is not the parent's or the family's first language. When you're having these conversations, it's really useful to start with an open-ended question, like, what are your plans for how your baby will sleep during naps and at night? Where does your baby sleep? Or what questions do you have about safe sleep for your baby? These are great ways to open up that conversation and to get some information from the family about their challenges, the barriers, and what their current sleep practices are, opening that interaction as an opportunity for education. What you don't want to do is start with a leading question like, your baby sleeps in a crib, right? Or you put them on their back, right? When you ask these kinds of questions, families really feel that there is a right answer. They may opt to give you the answer you want to hear as opposed to the truth of their situation. You really want to be able to capitalize on that moment and get to the truth about the issues they're facing and if they're practicing safe sleep consistently, so you can troubleshoot. As I said earlier, we know safe sleep is hard. One way to combat that with families is share tips and problem solve before they even get to that situation. You can suggest that they move the bed away from the wall and place the baby's crib near the bed. You can help families identify where to store items that are being stored in the crib. In our child fatality review process, we've seen that many families store items in the crib, which makes it easier for them to bring the baby into the bed, which is what we don't want. Helping them identify where to put these items can be really useful. For parents that are breastfeeding, you can suggest removing pillows and loose bedding from the bed, setting alarms, or engaging in activities that keep them stimulated and awake, like watching a favorite TV show. You can also share ideas for soothing a fussy baby, since we know that the infant crying very often is another common reason why people might not put the baby in the crib. Having these open conversations and sharing supportive resources is a very good multi-pronged way to encourage families to consistently practice safe sleep and protect their babies from sleep-related infant death. We covered a lot in this short video. We covered the motivation for Be More for Healthy Babies launch and the value of our citywide collaboration with leaders and providers in the public, private, and nonprofit sectors, the trends in sleep-related infant deaths in Baltimore and what that means for safe sleep education, the ABCDs and why the messages of alone, back, crib, don't smoke are so important, and how to talk with families in open, non-judgmental ways to ensure they hear how you and our city want to support them through what we all know can be a difficult time for any parent. As I mentioned, there are many more resources available on the provider portal. Please also feel free to reach out with any questions. Thank you.